Burks for Colorado Christian University, Intro to Biological Diversity, Professor Tracy Myron, December 19th, 2021. Caffeine and the brain. Instant human, just add coffee. Caffeine, coffee that is, consumption is one of the world's most devoured stimulants. Ever been parked in that long drive-through line at the nearest coffee shop or stood in the never-ending line at that favorite local coffee house? Well, then you would be among one of the 90% of American adults who enjoy a nice caffeine-infused hot or iced beverage daily. O'Callaghan, F. 2018. Caffeine may affect the sleep of older adults more than younger adults. Independent sensitivity to the disturbance of sleep due to caffeine is given by different functional forms of genes indicated in adenosine neurotransmission and metabolism, which is set apart in genetic studies, and by distinct individual differences existing in young people. Clark, I. 2017. While there are discussions after discussion and study after study that set out to show the many disadvantages of caffeine consumption, there are studies and programs that benefit the precious preemie newborns as well. Oh, baby, premature preemie caffeine benefits. Caffeine helps in managing a premature baby's breathing. Bronchial pulmonary dysplasia, BPD, is a chronic lung disease that can occur in very low weight birth babies. Caffeine reduces the occurrence of BPD and increases their chance of survival without neurodevelopmental disability at 18 to 21 months old. Studies of these infants have shown long-term success of caffeine relating to motor, behavioral, and intelligence skills. We see opposite results in animals when exposed to caffeine during pregnancy and lactation. The animals have negative neuronal development and adult behavior. Prenatal caffeine exposures will be more inclined to causing a low birth weight and low growth for the gestational age at birth. However, excessive growth, obesity, and cardiometabolic changes in kids can be due to caffeine exposure in utero. Caffeine therapy has had important progress in the care of newborns, giving instant benefits in preterm neonates. The more caffeine treatment is studied, the more defined the therapeutic window of treatment will be to give more beneficial effects on the brain and the lung. Studies are being done on adults who were preterm to determine the long-term effects of caffeine, which depends on caffeine's ability to control the influence of the expression and the maturation of adenosine receptors in the infants. Coomer v. 2019. The benefits, disbenefits in caffeine consumption cycle. Caffeine interrupts sleep. Interrupted sleep interferes with daytime performance. Caffeine helps improve performance. Side effect mitigation or performance enhancement. O'Callaghan, F. 2018. Caffeine excessive consumption disadvantage among young children. Not only is stress, anxiety, and depression related to caffeine usage, but the susceptibility among children are more likely to the involvement of alcohol and illicit drug use. Coomer v. 2019. Coffee, tea, hot cocoa, cold medications, and drinks. Such products as cold remedy analgesics, hot chocolate, tea, and energy drinks are often overlooked as caffeine consumption is reported. Most of society just thinks of coffee and soda when caffeine is discussed. It is extremely challenging to have a completely caffeine-free diet. As a matter of fact, very few people can be found who have a completely caffeine-free lifestyle to participate in clinical trials. Caffeine is consumed more for its stimulant properties than for its taste. O'Callaghan, F. 2018. A lack in sleep results in the loss of critical thinking. A meaningful decrease in cognitive function is due to sleep deprivation. These decreases in functioning include lapses in attention, alertness, vigilance, and the speed of cognitive and psychomotor responses. Losing just 90 minutes of one night's sleep can reduce daytime productivity, wakefulness by as much as 1/3. O'Callaghan, F. 2018. References: Clark I. Landholt, H.B. Coffee, Caffeine, and Sleep, a systematic review of epidemiological studies and randomized controlled trials. Sleep Med, REV 2017, February 31. Coomer V. and Lipschultz, S.E. 2019, Caffeine and Clinical Outcomes in Premature Neonates, Children, Basel, Switzerland. O'Callaghan, F. Merlick, O. and Reed, N. 2018, Effects of Caffeine on Sleep Quality and Daytime Functioning, Risk Management and Health Care Policy. This ends the presentation.